Sternum made easy. Medical study guide with clinical tips. What is the sternum? The sternum is a flat, elongated bone in the midline of the anterior thoracic wall. It protects the heart, great vessels and mediastinal structures and forms the anterior portion of the thoracic cage, along with ribs and costal cartilages. What are the three main parts of the sternum? Manubrium, body gladiolus, xiphoid process. How are these three parts arranged? They lie vertically, forming a slightly anteriorly convex structure that becomes narrower toward the lower end. What is the manubrium? The manubrium is the broad, uppermost part of the sternum. What is the jugular notch? It is the superior depression on the manubrium, easily palpable on the living body. Which structures articulate with the manubrium? The clavicles, forming the sternoclavicular joints. The first costal cartilage. The upper part of the second costal cartilage. What is the sternal angle? It is the angulation between the manubrium and the body of the sternum, and is an important surface landmark. What is the body of the sternum? The body is the long, narrow middle portion formed by fusion of four sternebrae. Which ribs articulate with the body of the sternum? Costal cartilages of ribs 2 to 7. Which vertebral level corresponds to the sternal angle? The thoracic 4 to thoracic 5 vertebral level. Why is the sternal angle significant? It marks the second costal cartilage and helps identify important thoracic structures during clinical examination. What is the xiphoid process? It is the smallest and lowest part of the sternum. What is the nature of the xiphoid process in early life? It is cartilaginous in early life and undergoes ossification later. What structures attach to the xiphoid process? Diaphragm, rectus abdominis, aponeurosis of the anterior abdominal wall. What structures articulate with the sternum? Superiorly, both clavicles. Laterally, first 7 costal cartilages. Inferiorly, the xiphoid process. How does the sternum assist in respiration? Its articulations with ribs and costal cartilages allow expansion of the thoracic wall during breathing. How does the sternum develop? It develops from 2 vertical sternal bars that fuse in the midline. How many ossification centers does the sternum have? Manubrium 1 center. Body 4 centers, 1 for each sternebrae. Xiphoid 1 center. How does fusion of the sternum progress? Fusion occurs gradually from top to bottom, superior to inferior, with age. Why is the sternal angle clinically important? It helps identify the second rib and indicates levels of key thoracic structures, such as the aortic arch and tracheal bifurcation. Why is the body of the sternum used for bone marrow aspiration? It is easily accessible flat, and contains active hematopoietic marrow in adults. When do sternal fractures commonly occur? They typically result from direct trauma to the chest. What is a median sternotomy? It is a surgical procedure, where the sternum is divided to access the heart and mediastinal organs. Thanks for watching. If this explanation helped you understand better, like the video, drop your question in the comments, and subscribe to Mo Sisters.